Hello everyone, and thank you for joining us today. My name is Dr. Philip Hritcko, and I'm the Dean of the University of Connecticut School of Pharmacy. And it is my pleasure to welcome you to this overview of our school's activities since the onset of the pandemic in the United States almost a year ago in early March 2020. COVID-19 brought challenges unlike anything we've faced before. After creating a safe environment in our buildings and classroom, our immediate priority was continuing the education of our students, one that offered breadth and depth of experience. Classrooms went from distance learning or virtual, and critical labs were broken into smaller groups to allow for proper social distancing. Experiential education also changed as many practice settings closed their doors to outside staffing and students as a result of this pandemic. As any trained pharmacist knows, experiential rotations are critical. Taking classroom learning and applying it to real-world patients in situations with preceptors is invaluable to education. I must commend our entire experiential learning team, led by Dr. Jill Fitzgerald, for working tirelessly to find ways to build experiential learning into our first year through fourth year student rotation schedules. Despite it all, our students rose to the challenge, to online learning, to carrying out experiential experiences, and to help the state to confront the pandemic with education, support, and providing vaccinations while following through on their own education and family situations. It was difficult for many. I can attest to the fact that pharmacy school was only one of the challenges our students faced. Family members lost jobs, got sick, and sadly, a few passed away, victims of this pandemic. Our Pharmacy Student Emergency Fund was tapped many times over, offering students financial help with housing, tuition, car repairs, and even food. We've been fortunate to have had this fund to source, but now look to replace the monies for future need. Through the year, we saw fortitude, resilience, and professionalism in our students, and a creativity born of a true desire to make the best out of an unprecedented situation. Here are a few examples. Led by seasoned expert faculty, some of our students created educational videos in 5 different languages that address some of the concerns and misconceptions surrounding the COVID-19 vaccines. You can find them on your YouTube channel. Students also got involved in critical contact tracing efforts around the state of Connecticut, and our faculty created and continually updated resources for licensed pharmacists on the front lines in immunization curriculum for those who wanted to help immunize. Because UConn School of Pharmacy requires immunization training and certifications for all pharmacy students, we were able to offer over 350 students with large-scale immunization efforts that began with healthcare workers this past December. As noted, our faculty experts developed online resources and information for registered pharmacists in the state to guide its fact-based coronavirus response and immunization rollout. We were commended many times for providing solid fact-based guidance in a healthcare environment that was riddled with rumors and misinformation. The entire effort from information to students was and still is being coordinated by our school's Office of Continuing Education and Professional Development, which created treatment fact sheets and developed a 21.5-hour immunization training certificate program for practicing pharmacists who wanted to know how to counsel and vaccinate patients and get involved with the immunization effort. Health system pharmacists are uniquely armed with the skills and tools to lead vaccine administration to healthcare personnel, as noted by Dr. Kimberly Metcalf, Associate Vice President of Pharmacy and Auxiliary Services at UConn Health, in a recent interview. Pharmacists understand the intricacies involved with storing, tracking, distributing, preparing, administering, and documenting vaccine quickly and accurately. They also have the clinical knowledge of how the vaccine works and the importance of its utilization. The profession is well poised to support this important public health initiative. Pharmacies will indeed be key to expanding the reach of the vaccine quickly. For many, pharmacists are the most accessible and trusted healthcare professionals to get a vaccine from. On our research side, in addition to compounding hand sanitizer when it was scarce, assembling COVID test kits, and sharing supplies and knowledge early during the pandemic, our faculty research labs have been running at full capacity. We have faculty involved with startups developing an antiviral drug for herpes SARS-CoV-2. School faculty member and researcher Dr. Dennis Wright, as an example, develops chemical compounds that target and block specific proteins in pathogens from performing their function, thus preventing the pathogen from growing. An article was recently published in UConn Today regarding Dr. Wright's research. Dr. Gregory Sarter is working to understand how molecular scale events in the brain drive substance abuse disorders. And researchers like Dr. Diane Burgess and Dr. Antonio Costa have licensed their continuous manufacturing system of nanoparticulate drug delivery systems. Research is another important place to support our school. If you have a research interest area and want to learn if a faculty member is working on a specific research project, please feel free to contact me. I am proud of our School of Pharmacy, students, faculty, and staff who not only made a challenging year productive, but also rose to help our state to confront the coronavirus, a public health emergency unlike anything we've seen before. The PharmD class of 2020 went out into a strange new world, and the class of 2021 will do the same, although far more is known at this time. Telemedicine has become common, and the pharmacist has become far more visible as a member of the healthcare team. Change is happening all around us and our school. We are up for reaccreditation this year, and we are ready to respond and teach to the challenges and changes that I've described before. As our nation turns the corner, with a new administration in place, vaccines rolling out, we know that we can get there. Because we are based in science, we know that we should be together again with family, friends, and each other very soon. So please, if anyone has any questions about our school or our involvement in healthcare, the state, or pharmaceutical research, please feel free to contact me at any time. Thank you for your time.